Good morning, everyone. Thanks for joining another webinar. Today we're going to be talking about community safety. So as frontline workers, how can we keep ourselves, our families, our community safe while working in the front line, as well as keep our clients safe as well. So it's 10 o'clock, so we will get started here. Again, we're going to be doing about a 30-minute presentation, and then there will be about 30 minutes after if anyone has any questions about community safety, or on Wednesday we talked about PPE, so if anyone has any questions regarding that or anything that's kind of come up in the last week, feel free, we can go over all of that. Before we start, I just want to acknowledge that StreetCred is thanking the Calgary Foundation for funding this initiative through a grant to the Boys and Girls Club of Calgary. So Westside Harm Reduction is utilizing this initiative to give presentations in regards to the response to COVID-19. So all the presentations and the promotional materials are all created by Westside Harm Reduction. So for those of you, if you haven't been on a webinar before, my name's Haley Moore. I'm the co-founder of Westside Harm Reduction. So I'm a registered nurse here in Calgary and have been working in harm reduction for just over 10 years within kind of the populations of people who are using substances and sexual health. So I just want to go over a few kind of housekeeping items before we start. The first one is I like to do an acknowledgement of First Nations. So I would like to begin by acknowledging that the land upon which we gather today is Indigenous land. We also recognize that the traditional Blackfoot name of this place, where the Bow River meets the Elbow River, is Mohkinstsis, which we now call the city of Calgary. We would like to acknowledge that we are on the traditional land of the Blackfoot Confederacy, Siksika, Kainai, and Piikani, as well as Treaty 7 territory, which includes Tsuut'ina and Stoney Nakoda, which is comprised of the three bands of Chiniki, Bearspaw, and Wesley. Calgary is also home to the Métis people of Region 3. And then the second housekeeping item I like to touch on is just acknowledging that, as always, this is a safe place. I'm hoping some of these webinars are helping to alleviate some of those fears and anxieties that are occurring from COVID-19, but just respecting and acknowledging that there is still that anxiety out there, and acknowledging that people are all having a little bit of fear right now, and then acknowledging that any question is okay. I know this is a different platform than we're all used to. Hopefully we're starting to get a little bit more familiar with it since we've been kind of going on with isolation for about a month here, but it's still a new platform. So still every question you ask is okay, and we're all happy to hear them, because most people, if one person has that question, more likely more than one person will. So we'll get started here. So what we're going to cover today is we are going to talk a little bit about some of the updates that have occurred with COVID since kind of our first presentation just over a week ago. We're going to talk about safety before work, going to work, safety coming home from work, and then we're going to get into some question and answer segments here. So just some updates. So COVID, again, it hasn't changed. It's still a large family of viruses, mostly found in animals, but it is responsible for like SARS, so severe acute respiratory syndrome, and the Middle East respiratory syndrome. And then here in Calgary, some of the cases that we're seeing. So we saw about 329 new cases yesterday in Calgary. So that's from 2 p.m. on Wednesday to 2 p.m. yesterday. And then total cases in Alberta were just under 4,000. So we're at 3,720. So again, most of those cases being in Calgary. So about 71% are in Calgary. Again, hospitalized cases, we're at 169, ICU 46, and then deaths have jumped in the past few days to 67. And then if we're looking at Canada, we're at just over that 40,000 marker with cases. However, Alberta is still leading the way with testing. So we are still behind Australia in that aspect. But up until yesterday, we had tested about 118,000 people in Alberta. So again, we're still seeing a lot of testing. And the more testing we're doing, obviously, the more cases we are going to see, just because of that increased testing. So some updates for you. Some Some things have changed just in regards to what people are saying for symptoms. So we used to say 2 to 4 days or 2 to 14 days for symptoms. Now we're actually just saying just flat out, it could take up to 14 days. And then again, we used to just be talking about asymptomatic transmission of COVID-19. And that was basically someone could transmit that infection before they test positive or before they show symptoms for COVID-19. And now we're actually breaking that up into 2 different categories. So people who have not yet developed symptoms, so pre-symptomatic, and then some people are just never developing symptoms with COVID-19, so they're completely asymptomatic. So that's why we've switched it up into those 2 categories. But whether you haven't developed symptoms yet, or you're pre-symptomatic, or never developed symptoms, you can still test positive and still transmit that infection to other people. Some of the symptoms actually have changed a little bit. We're still looking at cough, sore throats, shortness of breath, muscle aches, fever, sudden loss of taste or smell, but they have included runny nose and diarrhea in there, as well as just a symptom update. And then last but not least, some of the testing updates we are seeing. So up until just a couple weeks ago, or about a week ago, we were just doing the nostril swab and the nasopharyngeal swabs basically throughout worldwide. And now we've actually updated to doing a throat swab. It's not any more pleasant than the nasopharyngeal swab or the nostril swab. You really have to go quite far back into the throat to get an effective, accurate read on that. But they are recommending the throat swab now just over the nostril swab. So the difference between these is the nasopharyngeal swab is going very, very, very far back into the nostril. So they actually measure from kind of your mouth to your ear and then minus just a little bit for how far they're sticking that probe up your nose. The nostril swab was a deep nostril swab. So it was just going deep kind of into the nasal cavity up there. The problem with the nostril swab, why they're recommending the throat swab now over the nostril swab, is there was lots of differing attempts to communicate proper communication and the technique for those nostril swabs. So we were getting some different effectiveness and different efficiencies with that. And due to the kind of the global shortage now that we have of the nasopharyngeal swabs, they are recommending doing a throat swab because of that shortage. But the efficacy and the effectiveness of the throat swab to the nasopharyngeal swab are very similar, and if not more accurate with the throat swab. So a lot of places now are including that throat swab in there. So if someone you know or yourself needs to get screened and they tell you they're doing a throat swab now, that's perfectly fine. It's great that they are. And it just shows that this virus it's adapting in real time. We're learning so much about it every day, and we're constantly having to adapt to that. So in that circumstance, policies are constantly going to be changing, procedures are going to be changing. And that's why we're constantly kind of updating our webinars, because things are just changing with the new information that we're getting. Okay, so we're going to get into how to protect yourself within the community setting. So the best ways to protect yourself, really, they haven't changed. So still washing your hands frequently for at least 20 seconds, or using an alcohol-based hand sanitizer. If you don't have soap and water present, we are recommending using soap and water just to fully get off any of those particles that are left behind. Cough or sneeze into tissue or a flexed elbow. Some of these are just like best practice in general, right? So avoid touching your eyes, nose, and mouth with unwashed hands. I'm going to talk a bit about face masks kind of throughout the presentation, but wearing a face mask if you have respiratory symptoms, or caring for patients, or in areas where you can't practice social distancing. So that widespread mask wearing in community places, we're going to touch on quite a bit in the presentation, actually. Staying home if you're not feeling well, clean and disinfect surfaces people are generally touching, so we're going to talk about that too. Using the 2-step approach. So what that means is when you're cleaning, you're going to clean either with products that have like 60 to 70% bleach within them, or like Cavi wipes or Excel wipes or whatever your organization is using to disinfect. But you're going to wipe once, and the first time you wipe, that's just to get rid of any like debris or particles that could be on that surface. And then the second time you wipe, you're actually going to use like a new cloth or like the other side of a cloth if you're using bleach or a new Excel wipe or a new Cavi wipe. And that second wipe is actually what's going to disinfect that surface. So you want to do what we call that two-step approach. And then avoiding close contact with people who are sick, sneezing or coughing. So again, using that social distancing, keeping that 2 meters from individuals, just in general, right, as best practice. Okay, so personal safety before work. So this is just kind of day-to-day as a frontline healthcare worker or working frontline in any aspect in the pandemic. So have specific clothing that you're wearing to work. So you don't need to go through like all your clothing. Pick a specific set of clothes. Those are now your work clothes. Just wear them at work. This also includes shoes. So I know I've talked about this a few times, but make sure you pick a pair of shoes that those are your work shoes. Just wear them to work, clean them after you get home from work, but those are the shoes you're going to be wearing to work until this pandemic is done, just to reduce the risk of transmitting anything that could be on those shoes into the community. So you're going to disinfect your phone, your keys, high touch surfaces. So that includes like your steering wheel in your vehicle, so door handles, faucets. Make sure you're cleaning them often, just as like a general practice. And then I'm saying this now, I know it sounds kind of weird, but save your water, shower after work. We're kind of in this new era where it's okay if you show up to work without washed hair, because you're gonna have to wash it when you get home, which we will talk about that. So that's kind of that personal safety before work. So making sure everything is already clean before you're going into work. And then personal safety en route. So this can get a little bit tricky with depending on how you commute to work. It is spring now, so hopefully if you have the ability to like bike or walk or just get outside to go to work, if you live close enough, that's a really great option, because then you're getting rid of all those potential risks. But try your best not to carpool with other staff. In kind of recent studies come out kind of worldwide, they are recommending not to carpool, just and especially in Alberta, we've seen a few places where they've had an influx of cases, and they're actually looking at how people are getting to work, because people are carpooling. So you're obviously can't maintain that 2 meter distance when you're in a car. So if you are taking public transit, make sure you are keeping that 2 meters distance or wearing a face covering. I know the city of Calgary, I'm not 100% sure with other cities, but the city of Calgary, a lot of their seats are blocked off on buses. So it is giving kind of that 2 meter distance. The front entranceway to the bus isn't open. So they're only opening like back entranceways to protect bus drivers and just to keep people at that distance. So they are doing their best to promote physical distancing. But if you're on public transit, whether it's a C train or a bus to get to work, just make sure that you are taking those proper precautions and keeping that 2 meter distance. And it really isn't a bad idea to be wearing a face covering, which we will talk about. And then personal safety at work. And we talked a lot about this on Tuesday with PPE, but some of this is a little bit different. So make sure you are wearing that appropriate PPE if you can't maintain that 2 meters distance. So your gloves, your mask, your goggles, or some kind of face shield, in whatever capacity your organization has set out. If you can maintain that 2 meters distance, then PPE is not recommended. So if you work in administration or intake or leadership and you have that ability to keep 2 meters, or there's some kind of barrier between you and clients, then PPE is not indicated. But make sure you're not sharing equipment with other staff. So if we're looking at even like healthcare staff or sharing goggles, make sure they've been properly sanitized and dried before you're sharing that equipment, just to reduce that risk of transmission. Again, have work-specific footwear and don't wear them outside of work, only wear them to work. And then I know sometimes this is difficult because, even though we are working, we're still longing for that human communication and kind of that human interaction, which a lot of us are desperately looking for. But when you're on breaks, make sure you are keeping 2 meters from other people, whether In your break rooms, you're making sure chairs are kind of set 2 meters apart. If you're sitting at a table with colleagues, try not to actually be facing them, just in case you cough or sneeze, or I'm going to use Justin Trudeau's word, but speaking moistly, then you're not at risk of spreading respiratory droplets to other people if you're not necessarily facing them. So if you can keep 2 meters and sit kind of side by side, helps in that respect as well. So a lot of people have been asking, okay, what do I do when I get home from work? So, you know, like I'm wearing clean clothes to work, I'm keeping my house very, very clean. I'm cleaning everything regularly. And that's something that I potentially did before COVID-19. But what can I do when I get home from work when I've potentially been in contact with a positive COVID-19 individual, or someone who has ILI symptoms, so influenza-like illness symptoms? So how can I keep myself safe, keep my family safe, keep my community safe after I've potentially been exposed? So personal safety after work. So what I've been recommending for people in terms of clothing, you have a couple options. So some people actually bring a spare set of clothing to work and quickly change, like right before they're leaving. Their clothes go into like some kind of bag, it's sealed, but then they're in fresh clothes to drive home so that they're not contaminating their vehicle. Other people are just removing their clothes immediately when they get home, sticking them in the laundry as soon as they can. And if laundry isn't readily available at their house, or it's a shared laundry situation, just sticking all your laundry from your work environment in a garbage bag, tying it up, and then keeping it in there until laundry is available. And you can just keep adding to that bag until you go do laundry. One of the things that's really important though, when you're remembering doing laundry, if you're taking those clothes out of that bag, is wash your hands after, because any particles that could potentially be on that clothing are now on your hands. So make sure you're washing your hands after you do laundry, and that doesn't change even after you've taken off your clothes that you've worn to work that day. Make sure you're washing your hands before you try to touch any kind of surfaces within your house. So wash your hands before leaving work, and then as soon as you get home, or after you've taken off, as soon as you get home and then after you've taken off the clothes you've worn for the day, and put them in laundry or put them in a garbage bag. Disinfect your phone. If you keep your phone out at work, make sure you're disinfecting your phone, your keys, that ID badge that people are wearing, or name tags. Anything that's like not clothing that can be wiped down, that's got a hard surface, make sure you're cleaning it and wiping it down again, just using whatever solutions your agency has. So whether that's Cavi wipes or Excel wipes, anything with 60 to 70% bleach. One thing that's really important though when we're talking about disinfecting surfaces is not to mix different solutions. So if you're using Cavi wipes, just use Cavi wipes. Don't kind of use a Cavi wipe and then an Excel wipe, or don't mix different cleaning solutions. So if you've got 60% bleach and then you've got another cleaning solution and you're like, oh, well, if I add them both together, it'll be stronger. Just pick one so that you're not risking any kind of potential chemistry experiment when you're mixing chemicals. And then another thing you want to do when you get home is have a shower and wash your hair when you get home. So unless you are wearing a head covering, and that could be like a scrub cap, anything like that, make sure you're washing your hair when you get home, just because particles can stay in the hair as well. So like I said, shower after work. I mean, some people that's their routine. They shower right before they go to work. And this new showering after work is just kind of that added step. Some people have I know myself, I've just said I will shower when I get home from work, and it makes my morning prep quite a bit easier for that. And then personal safety in the community. So this is where I'm going to talk a bit about mask safety, that kind of thing here. And I'll go into quite like a substantial amount of detail with the mask coverings and how to put them on and all of that. But if you're in the community and you cannot keep 2 meters distance, or it's a community setting where there is high traffic people, so like grocery stores, or if you're in Walmart, or any organization where there's quite a bit of high traffic, it is not a bad idea to be wearing a face covering in public if you can't keep that 2 meters distance. So if it's kind of unreliable, if other people are kind of coming into your space, which can, like, you can do your best sometimes at the grocery store to keep that 2 meters distance, but we can only control our personal behaviors and don't really have control over other people's behavior. So that mask covering is important. And what that mask covering is doing, we've been promoting that widespread mask covering in public settings to prevent the transmission of asymptomatic or pre-symptomatic transmission. So that mask, if I am wearing a mask in public, it is protecting everybody else from me. And one of the reasons why I think it's so important to be doing this in public for people who are working frontline is we are in contact with so many people every day that the likelihood of us being an asymptomatic or pre-symptomatic carrier is going to be substantially higher than individuals who maybe are not working right now, who are working from home, who are not really leaving the vicinity of their house. So since we're seeing so many people, it is a very good idea for us to be wearing those face coverings in public just to protect the general public from what we have potentially been exposed to. Avoiding all non-essential travel. So this just means, like, if one person in your household can go do the shopping, that's fantastic. If you have, say, 1 or 2 people that have been working from home and they haven't really been exposing anybody to much, I mean, it's not a bad idea to get them to go grocery shopping instead of our frontline workers. But if one person in your family can go do the shopping, that's fantastic. And then avoiding kind of personal travel, so to other communities as well, especially coming from Calgary. So with Calgary having 71% of the cases in Alberta, it is really important that if we can, we just stay within our community and we're not kind of moving outwards and potentially infecting other communities as well. One of the things that I think this is really important for personal safety in a mental health capacity, is just recognizing that feelings of fear, stress, and worry are normal in a crisis. They are completely normal. So supporting your mental health and well-being is going to benefit yourself, your community, and also your clients. So making sure you're doing things for yourself when you get home. It can be very stressful working front lines in a crisis and in a pandemic, and especially with policies and procedures constantly changing. Make sure you set up some kind of routine for yourself at home to enhance your mental health and well-being, whether or not that's, like having a bath when you get home from work, or going out and getting a walk, or trying to keep some kind of mental health routine that's going to fill your cup instead of deplenish it. And then go outside and exercise, but try to stay as close to home as possible. So again, not going into especially smaller communities. If we're looking at like a lot of our mountain communities, it's really important that we're not going into those smaller communities and potentially bringing asymptomatic transmission there where they necessarily don't have the resources and capacity to deal with a substantial outbreak in those areas. And then if you're exercising, like here in Calgary, it's fantastic. It's finally spring. We should be taking advantage of that weather. Just try to make sure you're keeping that 2 meters distance from other people while you're exercising outside as well. We're going to get into masks here. So if anyone has any questions while we're talking about masks, just put it in the chat and I can go through it kind of as like in real time as we're talking about them. If there's something that you're just wanting some clarification on, we can chat about it in real time with the masks. Okay, so personal safety in the community, masks kind of 101. So community masks, it's really important that we understand that they are an additional protective measure. So they are not a replacement for social distancing or hand washing, coughing into a tissue, anything like that. They are an added precaution. So it's still, if not more important, to be washing your hands and keeping social distancing with that community mask. It's just kind of that add-on measure. So community masks are another way just to cover your mouth and nose and prevent respiratory droplets from coming in contact with other people or surfaces. So that's one of the reasons it is really important for us frontline individuals to be wearing that mask out in community settings. So it doesn't have, and we'll talk about kind of It doesn't have to be a like surgical mask or a medical mask. It actually preferably shouldn't. It should be, if you have a scarf that can cover your face, if you have one of the homemade masks, if you're very crafty and can make your own mask, those are fantastic options. We just want something to cover kind of the nose and mouth to prevent those respiratory droplets. And even if you can keep those 2 meter distance from other people, it's also the surfaces that we're concerned about as well. One of the biggest things, at least I've seen at the grocery store right now, is people with masks is they're not fitted properly. So you want to make sure that masks are fitted well and they don't gape at the side. So you shouldn't be able, if you can see someone's mouth through a mask from the side, it's not fitting well. So you do want it to sit pretty flush to your face. Masks can also become contaminated from the outside. So when you're removing the mask, you want to make sure you're taking proper precautions, which we'll talk about. And then cloth masks should only be worn for a short period of time, as once that fabric becomes damp, it can actually trap viruses and bacteria, which puts the wearer at substantial risk for even other infections or COVID-19, because once that mask is damp, it just creates kind of that vector for infection. And that would be the same if we're talking about medical masks in the hospital or in work settings. Once that mask is damp, it's no longer protecting anyone. And then have a baggie or some kind of container that can contain multiple clean masks, but then also have a baggie or container that you can put dirty masks into, so that you're not just putting a used mask into your purse or into your pocket, or potentially putting it in an area where it could contaminate other things. So we'll talk a bit about kind of how to put it on. I will show a video. It is a video for a medical mask, but it's very similar. And then I'll kind of walk you through it, and I'll put on a mask as well, just so that we can all be on the same page with how to put on a mask. Okay, so first step, before you put on, it doesn't matter if it's a cloth mask or a scarf, a medical mask or a surgical mask, you always want to wash your hands first, because you're touching your face. So you don't want to be bringing any kind of bacteria or viruses up into your face. So wash your hands, so that 20 seconds, soap and water. If you're kind of say on your way to the grocery store and you don't have soap and water accessible to you, hand sanitizer is fine. Needs to be an alcohol-based hand sanitizer. One of the things that I want to make sure with hand sanitizer that people are understanding is, if your hands are visibly dirty, so if you can see dirt on them, hand sanitizer won't work. You will have to actually get in there, scrub your hands for 20 seconds with soap or water. So alcohol hand sanitizer, if it's in the presence of like debris, dirt, fluids, it actually doesn't activate properly, so it doesn't kill the viruses or bacteria that need be. So that's why you have to actually physically remove those particles and give your hands a scrub if you can see dirt or fluids or anything on your hands. So you're going to be applying that mask when you're in the community and can't maintain that 2 meters distance from others, or you're in a place where there's lots of surfaces that you could potentially contaminate with asymptomatic or pre-symptomatic transmission. Okay, so I'm going to show a video here. I'm going to narrate it though, because I've heard from people that actually the sound on it doesn't work. So I just need to make sure it's on mute here. So you're going to grab your mask from the outside, placing it over your nose, so the bridge of your nose, and then attach one loop behind one ear and one loop around the other, making sure it's secure. You can kind of push it down and then pull it down over your chin. So if we're looking at, I just have a surgical mask with me, so it's just like that. But again, I'd apply it to my face, make sure it's kind of attached to my nose well, take one handle, put it behind one ear, other handle behind the other ear, and then lower to the bottom. So just like so. Some people have been finding that if you're wearing masks for a long period of time, even just kind of if you're constantly wearing them for short periods of time, that behind your ears are becoming raw and inflamed and just very irritated. So some people who are very crafty, not myself, because I am not, I'm taking advantage of my friends that are extremely crafty, have made kind of, they're just cloth like attachments. So it's just one cloth sheet. It's not very big. It's like 6 inches with a button on either side. So what you can actually do is you can attach the loops to this cloth, and then it actually prevents any kind of rubbing of the ear. We're using this a lot in like frontline settings, hospital settings right now, but it isn't you can totally use them in the community as well if you're finding that your homemade mask is just not, like, it's kind of rubbing funny. Those are a really great alternative just to add to it, just to make it a little bit more comfortable to wear. One of the things that if you are choosing to wear like a cloth, like attachment component, make sure you're washing this as well. So when you wash your cloth masks, make sure you're checking this in the wash as well. Okay, and then taking off the mask. So if we're looking at taking off the mask in the community, it's going to be the same kind of setup as it would be in the hospital. Here, I'll just put this, or in frontline settings. So if you have on your mask, what I like to do with it, just so that I don't spread particles everywhere, is I unattach one ear loop at a time, just so that it gets rid of some of that momentum. Attach the other side, or detach the other side, sorry. I'm going to lean forward just a little bit and then remove. So I find if I lean forward and remove one side at a time, that momentum is gone and you're not at risk of like flinging your mask across the room, or you're not worried about flinging any kind of particles that don't need to be there. So before you start, you're going to wash your hands again, because you don't kind of know what they've been touching. You're going to take off that community mask, just like I've showed you. Wash your hands again, but you're also going to put this lovely mask that you've worn in the community into a baggie. So that can be a cloth baggie. It can be just like a plastic bag, but make sure you're just putting it in some kind of bag prior to it being laundered, just to reduce that risk of contaminating other things. You're going to want to actually assume that mask has been contaminated at some point and take those proper precautions. So never assume just because you didn't see many people and you were wearing a mask that, oh, this mask is clean, I can just wear it again. Make sure you are taking those proper precautions. So taking that mask off using proper technique, regardless of the situation. If you have a mask on, anytime you put it on or take it off, you need to be using that proper technique of washing your hands, making sure the seal is good, and then when you're taking it off, washing your hands a few times and then taking it off with proper technique as well. And then again, just make sure you have that baggie to put it in. I recommend just putting it into that baggie even before you get into your car, kind of once you're away from everybody. Put your groceries away, and then before you get into your car, take off your mask outside, put it in the baggie, seal the baggie, and then use some hand sanitizer, and then get into your car and come home. That way you're not bringing any of those particles home with you. But that is one of the reasons why I mentioned make sure you're cleaning your steering wheel and different surfaces within your car, because sometimes we're in a rush to get home from work, or in a rush to get home from the grocery store. Things are busy for a lot of us frontline workers right now. So sometimes you're just not thinking, oh, I need to wash my hands a few times. So you come home, you get into your car, and you're contaminating those surfaces. So make sure you are washing your hands right when you get home. And it's a great idea, like a couple times a week, just go in your car and make sure to clean down those surfaces as well. So that's really like safety within the community. Again, things are adapting so fast and changing so fast. I'm sure there will be new community recommendations, by Tuesday when we do overdose response with COVID-19. But again, some of you have asked for these infographics to be distributing through your agencies. Again, I'm happy to send them anyone's way for anyone who wants them. So there's just some like personal safety tips, how to keep everybody else safe, type of infographics, and then we have an FAQ within the shelter setting that, again, I'm 100% willing to send any organization if they're wanting just some extra material, either for their staff or for colleagues or for clients. They're pretty easy to read and easy to break down here. So we'll get into the question answer segment. If anyone has any questions, they can just either go into that question answer box at the top or go into the chat box. Either way, I do record all of these presentations. So If anyone is wanting a recording of this, send me an email to info@westsideharmreduction.com. And if anyone is wanting a recording of the PPE video, I am happy to send that your way as well. Yeah, so I can, again, with the slideshow, I can send out the video of this presentation as well. If you're wanting more information from anything else that we've talked about on here, let me know, and I can send more information on that if you're wanting more for yourself, for your colleagues, or even clients. Like, it's really great to have clients stay informed with a lot of this information as well. And just how to get copies with the infographics. You can even just send me your email on here and I can forward them to you after the presentation. I can just send out quite a large email with anyone who wants them. Okay, so this is a really great question. So some of our clients are asking where they can get masks. Unfortunately, we aren't able to give any of ours out. Any idea where there are free, cheap, reusable masks for our vulnerable populations? So depending on what other agencies they are accessing, it's not the most sanitary or best practice, but if we can teach our clients how to properly take off their masks, so a lot of the organizations that they might actually access as well might be giving out face masks for clients to come in to use that space. So what you can actually do, you can actually save the mask. It's not the best practice, but for our vulnerable folks, if we just need some kind of face covering, it can work. I'm just going to grab a Tupperware container and kind of show you how you can save it. A lot of our clients, they do, like, they're so handy with like containers that they've got a lot kicking around with them. But if the mask is kind of on your face, what you can actually do is you can stick the Tupperware container kind of over your face like that. Same procedure. And then it just stays in the Tupperware container, and then you can just put a lid on it. So when you need to use it again, you can just put it back on like this. And then you're not actually touching any of the outside of the mask. It's kind of a handy little trick that you can use if for some reason you have to save those masks. But it's not actually a bad idea to put it out to some like community like individuals who are kind of needing something to do. Like, I'm actually happy to, I have a ton of friends that are extremely crafty and bored right now that have been making face masks. I'm sure we could probably get some people together to make some like cloth face coverings for our clients. And I think that's a really great idea, just to get that awareness out there. And a lot of us are from different agencies. We could probably work together and form some kind of group to get some reusable masks for our clients. And I think that's something that's really worthwhile in potentially looking into. So I will look into that today. And if anyone else kind of wants to jump on board and join into that, I'm happy to have more people kind of look into that with me. Okay, so regarding masks, some of our clients are complaining about breathing in CO2 from their breath and their nose, causing lightheadedness and nausea. So yeah, actually that's a very real thing. And coming from, like, I'm also working frontline in the pandemic where we're sometimes wearing a mask for kind of that 8 hours straight, and you take off your mask and you're like, oh, this is what air actually feels like, because you can get quite lightheaded. And one of the things that I do like recommend with that is, if you can just wear it for short periods and then kind of save it, it does help kind of keep that oxygen flow. Also, you are going to get a little bit more of that CO2 if that material that people are using isn't breathable. So if you're using cloth, you want to make sure like you are using some kind of like cotton or breathable material to make that mask, just so that you can breathe. But it is a really common complaint right now, not just with clients, but with like frontline staff, that masks are making them not feel super great. So if you have the ability to wear them short term, that's kind of your best bet. But I will, if you want to send me your email, I will look into that and just see if there's any kind of either masks that aren't causing that, or if there's any kind of tips and tricks that other people or other agencies are using. I will send out some information to you, but I'll kind of go down a rabbit hole with it and see what I can find for you. So wearing nail polish and jewelry is being discouraged when out in the community. Yeah, so that is correct. So any kind of jewelry that you can limit, so earrings, necklaces, watches, anything like that, if you don't have to wear it, like don't, just because you want to make sure you're cleaning those surfaces very, very well when you get home from those areas. So sometimes it's just easier not to wear them. But I know on like, if we're talking about organizations, when people are going to work, that's definitely discouraged. Like try your best not to wear anything extra than what you need, just to reduce that risk of surface contamination. And then nail polish is, if we're looking at kind of frontline healthcare, if it's fully intact, like there's no chips, there's no breakage, it's okay. But as soon as there's any kind of chip in that nail polish or any kind of crack, it's really easy for bacteria to get kind of under that nail polish and attach to your nail bed. And if you're thinking about how viruses and bacteria multiply, once it's a warm, dark place, like under nail polish, if you kind of think about it, it's kind of gross. But if bacteria gets under there, it can spread and it can multiply very quickly. So that's why we don't recommend wearing like nail polish, even just in general in healthcare settings. However, with clients, if we're talking clients with nail polish, I tell a lot of my clients that if they can avoid, especially right now, if they can avoid wearing nail polish, that's their best bet for a few different reasons. So one is that kind of that bacteria infestation that can happen with nail polish or fake nails, but also because a lot of clients are wearing face coverings to protect themselves, to protect others. If they have an overdose and their mask is up, it is harder to see. It's obviously harder to see if their lips are blue, what their skin color's like, all that stuff. So people are applying like SpO2 monitors or oxygen monitors a lot more readily. And if you have nail polish on it, it can make the reading not as accurate, just because the signals can't fully get through to your nail bed. I've kind of recommended that to clients, like if they can avoid nail polish when using it makes staff life a little bit easier in terms of trying to get oxygen reads and trying to see capillary refill, just to see what their circulation is like. But I mean, everyone has kind of their things that make them happy. And if they want to wear nail polish, like if clients want to wear nail polish, we just kind of work around that and figure out kind of other ways to assess for them. I just want to put this out to the group. Just someone that's on the chat right now has some extra 8-ounce bottles of hand sanitizer that they can share. So if anyone needs them, you can shoot myself an email and I will contact the individual who has that extra. And this is great that this has turned into such a strong community of people willing to help out and see that community response to COVID-19. It's really wonderful to see. Okay. Does anyone have any other questions here? we'll give it a minute or so here, and then again, I will send out, so I've gotten a lot of response for the infographics, so I will send those out after the presentation is done here. And then for those wanting a copy of the presentation, it takes about an hour for it to fully upload to kind of what they call the Zoom cloud. And then I can send it out to you once it's been uploaded, and I edit my very awkward 15 minutes out before our presentation started. Okay, so this is a really great question. So would there be concerns about clients wearing cloth masks because of the cleaning concerns, thinking about kind of our shelter system? So in the sense where that cloth masks can't be worn very long and that they need to be laundered, like there's no ifs, ands, or buts about the fact that they need to be laundered and not reworn, there is a bit of a concern with clients wearing those cloth masks if they're not being properly laundered. And I really can't speak for like our shelter systems right now or the DI as to whether or not they have the capacity to be helping clients launder those masks as well. But yeah, if they are wearing cloth masks, if you're seeing clients come in, encourage them to, like once they get wet, like even give them a baggie, if it can seal, something just like a plastic bag like this, that they can put that mask in until it can be laundered. I know like a lot of our clients, well, the majority of them are very, very resourceful and have kind of more tricks up their sleeves than we do with cleaning and that kind of thing. But if they, and kind of if worse comes to shove with cleaning cloth masks, I know this is kind of like a traveler's cleaning tip, but like there's like individual soap packages that people could potentially wash like in a sink and then just let them air dry if like worse comes to worse, but you want to make sure they're being cleaned in some capacity. So in terms of cloth masks for our clients within like that shelter setting, if they don't have the ability for it to be laundered, it would be best if they are wearing a disposable mask, just to reduce the potential hazards that could be caused for themselves, right? Because once that mask is damp, their risk for infection is higher. And that's not just with COVID-19, that's with kind of any bacterial or viral infection, because it's a damp, warm, dark place, and bacteria and viruses just really like to multiply there. But I think we might, all of us in frontline, we might be getting very creative in our tactics with COVID-19, because we're going to have to probably adapt to a lot of situations. But again, like I'm happy to kind of work with you on that and see what we can come up with for clients. Again, like what I kind of used in this kind of Tupperware container, this is a surgical mask that I've like kind of just put in, that this container will need to be washed, but you know, and I've seen it happen a lot in the States with like nurses who are having to use like N95s, and this is actually how I stole that idea. This is how they're storing it. But just to kind of keep that contaminants on the outside of the mask and not in the face.